Good afternoon, everyone. Thank you so much for being here. I'm still letting some folks in, so if you don't mind, we'll begin in just a minute or two. Okay, I think we can get started. Oh, here's someone else. Um, Beth, if you see anyone else trying to enter, will you please let them in? Because I'm not sure I'll see them once I share my screen.
No problem.
Thank you so much. I will share my screen. And welcome, everybody. Welcome to the 2026 Parity and Behavioral Health Legislative Policy Briefing. Thank you for being here today and for your interest in these issues. My name is Lori Marie Peixoto, and I'm Executive Director of the Mental Health Association of Rhode Island. If you're not familiar with us, we are a small private consumer advocacy nonprofit, and we try to elevate the voices of people who live with mental health conditions and improve the system of care in Rhode Island. I identify as someone who has lived experience as well. You may have attended one of these events in the past. Mahari and our friends at NAMI Rhode Island usually co-host this policy briefing. Today we're joined by some of our coalition partners. Um, Beth Lamar of NAMI Rhode Island and the other advocates that you'll meet here today have been working tirelessly to move forward several pieces of legislation and state budget items, many of which you'll be introduced to today. So let's begin. We'll cover a lot of ground today, and we've grouped legislative bills and budget items into five buckets. They are increasing equitable access to behavioral health care, supporting youth mental health, supporting Rhode Islanders who live with serious persistent mental illness, investing in the continuum of care, and regulating artificial intelligence in healthcare. We'll also have a small conversation about what you all can do to help move these policies forward. And then we'll have questions and answers and perhaps a conversation. For context, I thought we would start with a statistic. 1 out of 4 adults in Rhode Island lives with a diagnosable mental health condition. These are our parents, our children, um, family members, colleagues, friends, neighbors. And this figure is actually slightly higher in Rhode Island than the national average. Rhode Island has made meaningful investments over the past few years, and we're very grateful to our leaders for all of their investment in our behavioral health care system. For example, we recently secured a federal rural health transformation grant, which will have a sizable investment into our crisis stabilization services and recovery community centers and peer navigators. The state also added 46 new residential treatment beds, which is a huge accomplishment because when we don't have enough beds, people go on wait lists for care. We've also seen reduced wait lists for children's services, and in part that might be due to the state's investment in crisis stabilization services. We've seen continued investment in certified community behavioral health clinics, the 988 suicide prevention line, affordable housing, specialized group homes. And the state also fully staffed and funded the Olmsted coordinator in the Executive Office of Health and Human Services. And we'll talk a little bit more about what an Olmsted plan is later on in the presentation. Despite all of those terrific accomplishments, of course, there's still more work to be done. There's still more need for investment in the system. We continue to have a broken continuum of care in Rhode Island. This means that there are wait lists for every level of care, particularly for adults. We don't have enough step-down programs, such as residential treatment or partial hospitalization. And so someone who is just being discharged from a hospital might be discharged back into the community without those intensive supports around them. And that, of course, increases the chances of relapse. We continue to see a shortage of adolescent psychiatrists. Non-fatal overdoses are on the rise, and I was looking into why this might be, and there are a few different reasons. Um, First of all, our country is going through some difficult times right now, and the national landscape, of course, can affect people's mental health. And so we're seeing perhaps an increased uh, incidence of using substances, but we now have more education and awareness and access to reversal agents like Narcan. So while people may be using more substances or combining different substances and having an overdose, we are able to save more lives. And that is a huge benefit. That's a huge gift in all of this. We continue to see insurance barriers as well. When an insurance plan could delay or limit or even deny treatment. Most recently, something that we'll see have an even bigger impact in the future is that we've had recent federal rule changes to Medicaid eligibility, which means fewer people qualify for Medicaid, and those individuals will undoubtedly lose access to healthcare services, including mental and behavioral health care. And of course, that will place a burden on the system, and it will, of course, have a profound impact on their lives and their family members' lives. So there's more work to be done. And now I'd like to introduce Kara Cheevers, who is Vice President of Coverage Policy at Inseparable. Some of these bills that she'll talk about might be familiar to you from previous years, but we also have a couple of new ones that we're really excited to share with you.
Thank you so much. As Lori said, my name is Kara Cheevers, and I'm with Inseparable. We're a national mental health advocacy organization who has the privilege of working with a number of states, including Rhode Island, and many of you on this call. There is a bill package uh, that really looks at how we reform commercial insurance coverage and Medicaid to some extent to make sure that people with coverage are able to get the best and most comprehensive and most affordable mental health care they can with the insurance that they pay for. Some of the tools that we'll talk about include mental health parity, like you'll see on the slide. So it also includes more of a requirement or policy change to hold insurers accountable in slightly different ways. So we'll get into it. The first bill looks at the practice of prior authorization. So we know that insurance companies use prior authorization to require doctors to obtain approval before delivering care, even when that treatment is covered and it's clinically recommended. A recent American Medical Association study found that 93% of physicians reported that prior authorization created significant delays in necessary care and could oftentimes harm patients, especially for mental health care. This bill does a number of things to reduce or eliminate that barrier to care. It first prohibits insurers from requiring prior authorization for in-network behavioral health services. So again, these are services that are already covered and they are in-network. They're removing the tool to basically delay or limit care for mental health services. It also increases timely access to services by preventing crises, reducing emergency room visits, and worsening health conditions. Some carriers, like Blue Cross Blue Shield of Rhode Island, have already had this policy in effect since 2019. this bill will change it so it's a requirement for all carriers moving forward. It's been heard in the committees and it's being held for study right now. Go on to the next slide. Thank you. The next bill looks at what we call generally accepted standards of care, or the medical necessity criteria that insurers use to determine if the health care that you're seeking coverage for, that your doctor says you need, is actually something that they're going to cover. In Rhode Island, many families don't get the treatment they need, even when their insurance company promises to cover those services. These inconsistent and opaque rules can lead to delays, denials, and treatment being cut short. So this bill will expand consumers' access to services by closing those loopholes that help patients get the mental health and substance use disorder care that they've been promised. It also ensures that insurance companies are not denying coverage for medically necessary mental health and substance use disorder care. It will also increase the transparency around coverage denials. So if a patient is denied care by their insurance company, there's going to be more requirements and more of a framework on what they must be told and the information they must be provided by the insurer. This bill has been heard in committee and is being held for study. And then next we'll go to the Protect Mental Health Act. Thank you. Mental health parity, which means the comparability of coverage between mental health and physical health, has been the law of the land since 2008. But even still, a recent federal audit found that not one insurance plan could prove it was following the parity law. In Rhode Island, large disparities remain. Large disparities between physical health and mental health specifically. And people seeking inpatient mental health or addiction treatment are 10 times more likely to go out of network to see a psychiatrist than another specialist. And they're 20 times more likely to be sent out of network than those needing medical care, meaning that they're going to receive higher costs and they're going to have fewer options. So this bill really addresses problems like these by ensuring that Rhode Islanders aren't harmed by federal mental health care rollbacks. It will fight insurer discrimination against Rhode Islanders seeking mental health care, and it will ensure fair access by requiring that insurance companies can prove mental health parity compliance. This is being heard in, or this, excuse me, this has been heard in committee and is being held for study. Lovely. And the next bill, the last one that I'll talk about today, pertains to the problem that in Rhode Island, many providers do not accept insurance due to very low reimbursement rates from commercial insurance companies. The data show that Rhode Island mental health providers are reimbursed significantly less than physical health counterparts, despite comparable licensure and education requirements. This bill establishes a reimbursement floor, which will promote fair compensation and encourage providers to remain available and in the network. This ultimately will get at the problem of somebody who's experiencing some sort of crisis but isn't able to find a provider in network using their insurance. We want to make sure that we're incentivizing and appropriately paying providers for the care that they're delivering, and that insurers are complying with different laws. This bill will specifically prohibit insurance companies from paying less than the Medicaid rate as determined by Rhode Island state government. It'll retain and increase the number of in-network providers available to see patients. It'll reduce consumer wait times and overutilization of expensive services like the emergency room or other services that are used when somebody's in more of an emergent or crisis situation. Lastly, this bill has been heard in committee and is being held for study. And next, I'm so pleased to introduce Beth Lamar, who is the executive director of NAMI Rhode Island. NAMI, or the National Alliance on Mental Health, or excuse me, Mental Illness, leads efforts to provide support, education, and advocacy for individuals and families affected by mental health conditions. Beth is going to share some information about youth mental health in the next few slides. I'll give it to you. Thanks, Beth.
Thank you, Kara. So, youth mental health is so important. As we know, the earlier that we can connect people to the help they need, the better the outcomes for their mental health over time. 1 in 6 youth in the United States experiences a mental health disorder each year. 10,000 adolescents in Rhode Island have serious thoughts of suicide each year. 15% of youth 0 through 17 experience 2 or more adverse childhood experiences, which happen to be linked to the development of mental health conditions and substance use later in life. And yet, According to Rhode Island Kids Count, 52% of children ages 3 to 17 had trouble obtaining the mental health treatment or counseling that they needed. I'm going to provide an overview of two pieces of proposed legislation with direct impact to youth mental health services, and then a third that can help to support the efforts of those. First, we have House Bill 7456, introduced by Representative Shellcross Smith, and its Senate Companion Bill 2245, introduced by Senator Sosnowski. This legislation would mandate that public schools have one full-time social worker for every 250 students. The current ratios in Rhode Island are 713 students to every one school psychologist. And the recommendation in the industry is actually 500 to 1. For many youth out there in Rhode Island, school is the only access point that they have to mental and behavioral health care services. And in many cases, it might be the only safe space or the only place where they know a trusted adult. Slide, please. Next, we have the House Bill 7116, introduced by Representative Lombardi, which would require the Rhode Island Department of Education to develop and make available a 4-hour mental health curriculum for all seventh grade students. This curriculum includes topics on mental health awareness and suicide prevention, such as stress management, recognizing the signs and symptoms, and how to seek help. And it actually is expanding upon 2017. There was legislation passed already into law that required statewide education for seventh graders, but unfortunately, it was an unfunded mandate with no specified curriculum. So this would help schools to provide the tools to be able to comply with that. Next slide, please. Related to the previous two, we also have House Bill 7455, which was introduced by Representative Furtado. This bill would mandate additional state education funding for mental behavioral health of students that would be equal to 2% or greater of each district's total expenditures, which would be used for staffing, such as school social workers and behavioral health specialists. All of the bills that I have covered have been heard in committee and all have been held for further study. Back to you, Lori.
Thank you so much, Beth. That was great. So now I want to talk about how we can support Rhode Islanders who live with serious persistent mental illness, or SPMI. About 5% of our fellow Rhode Islanders live with SPMI. SAMHSA would define SPMI as someone over 18 who lives with a diagnosable mental health condition or an emotional disorder that substantially interferes with a person's life and ability to function. This could include conditions like a bipolar disorder, major depressive disorder, and schizophrenia. This first piece of legislation here is House Bill 8275, sponsored by Representative Felix, and Senate Bill 2977, sponsored by Senator Acosta. Some folks with SPMI can manage their illnesses with medication and live in the community and work. Others cannot. They might need, and they certainly deserve, compassionate help. If the state does not provide appropriate supportive housing or home-based services, people with untreated SPMI can become homeless and then be arrested for crimes related to homelessness. Once incarcerated, people with SPMI might have difficulty following prison rules, and often prison officials will place inmates with SPMI in solitary confinement for their own protection so that other inmates don't harm them. So, for these reasons, solitary confinement is disproportionately used on inmates who live with SPMI. In Rhode Island, we don't call it solitary confinement. We call it segregated housing, but it is solitary confinement in effect. Experts will tell us that solitary confinement for extended periods of time is psychological torture. It exacerbates mental illness. Many in solitary confinement will experience self-harm, hallucinations, paranoia, irrational anger, and 50% of all suicides that take place in a prison occur in solitary confinement. This legislation would create a committee that would have some oversight on how restrictive housing or solitary confinement is used in our state, in our prisons in Rhode Island. Um, the both bills are being held for study, and it does not seem likely that they will move forward this year. This bill has been kicking around at the State House for a long time now, and it's something that Mahari hopes to prioritize our advocacy for next year. But this is a really important bill. You might recall the last few years, Beth and I have talked about Olmstead plans and why they're so important for Rhode Islanders. Olmstead refers to a U.S. Supreme Court in 1999 that said states have an affirmative legal option to ensure that people with disabilities and others who are vulnerable to institutionalization can live, work, go to school, receive services in the least restrictive setting. Over-institutionalizing someone is a violation of the Americans with Disabilities Act. It's a violation of civil rights. And states do get sued occasionally by the U.S. Department of Justice. It took a number of years, but many coalition members here today and some who are not here today worked really hard to help persuade the state that we needed to establish an Olmstead plan in Rhode Island. The plans are kind of like roadmaps, and they start with a statewide needs assessment. What do we have? What do we need? What kinds of resources will help Rhode Islanders stay out of nursing homes if that's what they want to do? What do we need to make sure that Rhode Islanders with disabilities can get to and from their jobs? You know, what's missing and what do we need? And then a plan would, for the next 3 to 5 years, sketch out how to obtain the resources to invest in those needs, whether it's home modification or transportation or supports in schools. And so this helps reduce the over-institutionalization of people who are vulnerable to that. It also saves money to the state when we're not overutilizing expensive levels of care, like nursing homes, when someone might prefer to age in place in their own home. Um, and having a well-funded and well-working Olmstead plan can help us reduce the likelihood of being sued by the U.S. Department of Justice. It's not a sure thing, but it certainly helps. And so in our state budget, which is Bill 7127, sponsored by Representative Abney, there is funding to continue to staff the Olmstead coordinator role and to continue implementing the Olmstead plan. And we're very grateful for that. A quick piece of legislation I wanted to mention is 7676 by Rep. Speakman and 2612 by Senator Zurier. This would amend the Rhode Island state open meetings laws so that individuals who are not able to physically attend a public body that they may be an official member of would have the option to use video conferencing at home, and they wouldn't have to pay for that technology. The state would supply that technology. So I'm very excited to report that it passed the House very smoothly. It has not been heard in the Senate yet, but I've been told by some folks in the Senate that they plan to hear it and they'll cluster a group of similar bills together for the same hearing night. So I feel fairly confident that both bills will pass and be signed into law by the end of the session this year. Very excited. And now I'd like to introduce, is Dana here? If not, Josh Kerman from Newport Mental Health.
Lori, I think I'm going to take the first one on
Oh,
988.
sure. Sure. Thanks,
Um,
Ryan.
yeah, if you want to flip to our 988 slide, good afternoon, everyone. Ryan Pickering on behalf of Horizon Healthcare Partners, which, as you know, operates Rhode Island's 988 Crisis Lifeline. So we serve as the front door for many of the investments that our state has already made like CCBHCs and MRSS programs. And we're very proud to rank at the top of 988s nationally for in-state answer rate. About 99% of those calls being answered in-state. And we do know that this is working. So just a couple of weeks ago, data out in the Journal of American Medicine found that since 988 launched in 2022, we've seen a national drop in youth suicides by about 11%. And we in Rhode Island were identified as a high uptake state, which reduced by nearly 18%. So we're also happy to see that legislation that we've supported to include 988 on all student ID cards moving forward has already passed the House. We think that's a very good idea. But ARPA funds do run out this year, and we are urging the General Assembly to find a sustainable long-term source. This year, we're thankful that the Senate included us in their package of healthcare priorities to codify 988 and BH Link, which is our 24/7 crisis receiving and stabilization center. That's already been heard in Senate Health and Human Services. In the House, Representative Shalcross Smith has submitted our legislation 8177 with a sub A that essentially does the same thing. That was heard actually last night, very late last night. So that's where we stand on 988. Among those riding it out with us was Dana Gladstein, CEO of Newport Mental Health, who's also here today. I'll turn it over to her. She's going to review some priorities on CCBHCs, which are obviously very closely linked to a lot of the work that we do here at 988.
Good afternoon, everyone. CCBHCs are strengthening behavioral health systems nationwide by expanding timely access to mental health and substance use coverage, crisis response, care coordination, and integration with the broader healthcare system. In Rhode Island, that national model is taking shape through expanded outpatient access, mobile crisis response, care coordination, and stronger connections between 988, MRSS, and which is the children's mobile response, and ongoing community-based services. Through the enhanced Medicaid match, Rhode Island also receives higher federal reimbursement for full costs of our CCBHC services, which helps the budget support a more comprehensive and sustainable model of care. Rhode Island's early results are very strong. In year one, the CCBHCs reached 16,700 Medicaid members, and attributed membership grew by 7%. Monthly engagement, meaning that clients actually came in or were seen in the community, ranged from 70% to 80%. That is pretty high with populations with SPMI. More than 2/3 of crisis calls were resolved without emergency department use or hospitalization, and 79% of urgent crisis were resolved without law enforcement escalation. What I heard last night, I really like the phrase resolved without handcuffs, which is really important. Nationally, CCBHCs now serve 3 million people. 79% of clinics report serving more people after becoming a CCBHC, and Medicaid-funded CCBHCs increased the number of people served by 33%, which Rhode Island is seeing that as well. The model is also expanding treatment capacity, with 87% of CCBHCs offering medication treatment for opiate use disorder, and more than 80% partner with 988 call centers. In Rhode Island, CCBHCs are increasingly serving as the backbone of the behavioral healthcare system, and in many ways, a key part of the broader healthcare system as well. Many don't know this, but workforce is another key part of the model. Nationally, CCBHCs added 11,200 positions, and Medicaid CCBHCs added a median of 22 positions per clinic. Rhode Island is following that path through 6 CCBHCs, where 91% statewide coverage, multidisciplinary staffing, and continued investment in implementation and recruitment. So we're seeing, like, for instance, at Newport Mental Health, our retention during COVID was 44%. It's now 8%. So 92% of the people we hire stay in those positions, which is incredible. And I attribute that to the infrastructure that we've been building with the CCBHCs. Rhode Island is following that path again with 91% statewide coverage and soon to be 100%. And in short, CCBHCs are building a more coordinated community-based behavioral health system. Nationally, the model is expanding access, workforce, and support with 988. In Rhode Island, it's already driving measurable progress and stronger framework for healthier communities. So we're already seeing, in year one results, we're already seeing healthier communities. We want to make sure this stays adequately funded in the 2027 budget. And we need to participate in any of the research commissions on braided funding to make sure that our funding model for this program system of care is maintained. And I will introduce Rebecca Gowertz, who is the Executive Director for National Association of Social Workers.
Hi, everyone. Thank you so much for having me, and thank you to Mahari for hosting this event, which is a great way to bring us all together to talk about these important issues. If we could go to the first slide, there's 2 slides, I believe I have that. Great. Thank you very much. So the first bill we wanted to talk about is the Wellness and Oversight for Psychological Resources Act, which is a bill filed in the House by Representative Shawcross Smith. It prohibits AI from providing advertising or representing therapy or psychotherapy services. It bans AI from detecting emotions or mental states for therapeutic purposes. We're looking at some suggested amendments to the bill. It protects all AI-handled data. Patients cannot be treated safely or ethically by chatbots posing as therapists. We know this, and I'm going to talk about that a little bit more in the next slide. But this bill is really geared towards how to regulate AI when it's in the mental health space and in the clinician environment. And so Illinois and Nevada already passed this legislation. It's almost verbatim what was filed here in Rhode Island. And there are several other states that are well along the way to passing this bill into law. Because we know AI is changing our environment very, very fast. And we have to make sure that people are protected along the way. The main thing is protecting consumers who are at great risk, especially people who are struggling with mental illness. You know, when now all of a sudden there are chatbots that seem like they understand you and seem like they can provide empathy, but they cannot because they are computers. So we want to try to see if we can get this passed. And the next slide is the other bill that has a House and Senate companion that we're hoping to see if we can get these 2 passed. So Representative Spears and Senator Urso have filed. So again, this is the artificial intelligence. Yeah, there's a little typo in the top there. It's no problem. Companion Model Act, which is identical in the House and in the Senate. It protects consumers from unregulated and unlicensed artificial intelligence chatbots, basically the models that the companies create. And it adds penalties for violations that result in physical harm to individuals. This is really important because it's not enough to say that's wrong. There really has to be a consequence that if you're going to do this, then you're going to kind of unleash these chatbots out into the world and into Rhode Island and expect that it's not going to cause a problem or not worry about whether it causes a problem. There have to be penalties if there's violations. It prohibits companies from operating or providing an AI companion to a user unless the AI companion contains a protocol. And basically, the protocol has three parts. It has to address possible suicidal ideation or self-harm expressed by a user, possible physical harm to others expressed by a user to the AI companion, and possible financial harm to others by the user to the AI companion. That includes, but is not limited to, a notification to the user that refers them to crisis service providers, such as a suicide hotline, crisis text line, or other appropriate crisis services. And we did just hear about some of the great crisis services that exist in the state, in addition to the 988 program that's been rolling out really well. The other main thing about this bill that I just want to briefly touch on, and what I think is really important about it, is that it requires a company or the operator to provide a notification to a user at the beginning of any AI companion interaction, and at least every 3 hours for continuing AI companion interactions after that, which states either verbally or in bold in capitalized letters in at least 16 point type the following. The AI companion is a computer program and not a human being. It is unable to feel human emotion. So we really want to see this get passed. We think it's very important for all of the consumers and providers out there doing the important work of providing mental health services. So thank you.
Thank you so much, Rebecca. So we started with a statistic, and that can be helpful for context, but statistics, numbers, they don't tell the human story. When we fail to care for our most vulnerable Rhode Islanders, when we financially neglect a behavioral health care system, there's a human toll to that. People have to wait or even go without services and care. People are on wait lists for supportive housing, specialized group homes. Folks may become homeless and unemployed, or young people can't learn in school when they have an undiagnosed health challenge. And all of this, of course, strains our Rhode Island families, it strains our communities, it strains the system. It's a snowball effect. And while the state may, in fact, save a little bit of money up front by not investing in this or that part of the continuum of care, we know that there are increased costs downstream because it costs money to incarcerate individuals and go through the legal process, and it costs money to have to use hospitals and emergency departments as the first place that someone goes when they're having a challenge instead of BH-Link or a CCBHC. So we're really not saving money in the long term. I guess you could say it's penny wise and pound foolish. One last piece of legislation I'll mention is that we know building a strong continuum of care takes resources, it takes money, and we have an opportunity to raise revenue in Rhode Island. It's called the Revenue for Rhode Island Bill. It's been spearheaded by our friends at the Economic Progress Institute. I think it's 2 or 3 years old at this point. It's 7313 by Representative Alzate and 2238 by Chairwoman Melissa Murray. And what it does is very simple. It adds a 3% surtax on individuals who earn more than $640,000 per year. And if passed, it would raise approximately $200 million per year. And that $200 million per year could go toward, in part at least, the behavioral health system in Rhode Island. Both bills have been heard in committee and are being held for study. And now my friend Caden Fabi, who is the the Director of State Affairs at Inseparable, will talk to us about what each of us can do to help move these policies forward.
Good
Welcome.
afternoon, everybody. Great to be here. Thanks, Lori, and again, Caden Fabi, Director of State Affairs with Inseparable, and it's been a real honor to be leading our Rhode Island campaign work, and great to see so many familiar faces and passionate advocates on this call today. We'll go to the next slide. You all just heard about some really great pieces of legislation that we, as a coalition, are hoping to advance this year to improve mental health access for Rhode Islanders. And I'm really quickly going to put in the chat a policy platform that kind of outlines several of the bills that we talked about today for your reference. But I don't know about you, but I'm convinced that all these policies will make a really big difference, and we need to get these things across the finish line in the legislature and signed by the governor this year. This is urgent. And so we have two different audiences here today. First of all, for any legislators that are on the call or are watching this on their own time at home, just wanted to let you know how you can help push forward as passionate mental health advocates these pieces of legislation. And first of all, it comes down to prioritizing these bills, right? You heard pretty much all of these bills have been heard in hearings already, have been held for further study. And now is the time where we really need to be letting folks know that these bills need to be voted on in committee and passed out of the legislature. And so we encourage any legislators to prioritize these bills and these budget items, to continue to have discussions with colleagues and constituents about the importance of advancing mental health legislation during this critical time. And I'll also note, I think several of you are aware of this, but it's Mental Health Awareness Month in May. And, it couldn't be a more important time to be having these conversations and engaging with advocates that are in your own districts and within your health and within the behavioral health community. I know there are some upcoming events still in the final couple of weeks here in May where you'll have those opportunities to interact directly with those who have lived experience or have family members who have lived experience or just want to see Rhode Island make advancements in mental health policy. So encourage you to have those conversations throughout this month and throughout the rest of the legislative session. For all the advocates on the call that are listening, and want to take action right now, I have an opportunity for you right this second to contact and share your story with legislators in support of these bills. So I'm really quickly in the chat going to go ahead and put a link where you can take action right now. All you have to do is add in your own name, your information, your address, and you'll be connected directly to your legislators with a template message that you can edit. Include your own story and share the behavioral health platform that I previously added into the chat with your legislators. A lot of this just comes down to awareness. We want legislators to be prioritizing mental health and these bills when they have so many other things going on. We need to make sure that they're focused on these pieces of legislation. And that's one way that you can make a difference right now. I also encourage you to call the offices of your elected officials, to write to them at any point, to share your story, to meet with them directly at the State House. These are all great opportunities to let them know how important these pieces of legislation are to you and to your community. Some other really great opportunities for you to gain your own, increase your own education if you're interested. Our partners on the call, Mahari and NAMI Rhode Island, have really amazing programs for people with lived experience to gain the education, the experience to be able to communicate their own stories with elected officials. They're really amazing programs led by our friends Lori and Beth on the call. And so encourage you to plug into those if that's a way that you want to increase your own education and advocacy skills. Some other ways that you can stay connected to us as a Behavioral Health Coalition community: subscribe to our newsletters for information and regular action alerts. We try to keep you updated as much as possible about the happenings at the State House and really important timelines and deadlines where we really need your voice to be heard. So encourage you to do that. You can also attend our coalition meetings and continue to support our work there as well. With that, I'm going to turn it over to Lori to close us out.
So this is our contact information for the organizations who participated here today. We've given you our names and email addresses and phone numbers and websites. And I can email this presentation out to attendees when we hang up today, and you'll have this for your records. And these are our logos. Love to thank, of course, Beth Lamar at NAMI Rhode Island, Ryan Pickering from Horizon Healthcare Partners. Let's see. Inseparable, Kaden and Kara, Dana from Newport Mental Health, and Rebecca from the National Association of Social Workers. And then we had some other partners help prepare this presentation, and we want to thank Community Care Alliance and Ripon. And now we'd love to invite you to the annual State House event in honor of Mental Health Awareness Month. This we anticipate being a really huge event this year. It's on Tuesday, May 26th at 2:30. If you just show up at the State House, you'll know exactly where it is because there'll be a huge crowd on the second floor. Parking is free at the Providence Place Mall for the first 2 hours, and there's also metered parking in the neighborhood. Um, we are presenting awards to former Speaker Shikarchi, Senator Uji Fusa, and Karen Jeffries, formerly with Horizon Healthcare Partners. We'll also hear from three courageous individuals who will share their stories, hope and inspire hope and inspire empathy and build understanding. And so it will be a really special day. Barbara Morse from NBC 10 will be there as well. She'll speak for a little while. She'll also cover the event on her news program. And as I said, it's a really special day. Everyone is welcome. And now we would love to hear from you. Do you have questions? Do you have suggestions about any of these bills? We'd love to have a conversation with you, so please feel free to chime in. Catherine, hello.
Hi, Laurie Marie, and thank you for all of the presenters today for bringing this to the forefront, and thank you for all your work. I know it's a lot of hours, a lot of time, a lot of energy. I did put in the chat that we at the Rhode Island Psychological Association have been really monitoring that AI work. It's, on the surface, hearing that these states have already passed it and let's get on it. There are some real problems that we see in terms of for providers that we're working directly with legislators to try to really refine that language so we don't get caught in a position where we can't use our AI to augment our therapies. And we don't hold the liability if something goes wrong. I compare it to, a heart surgeon is not held liable when the valve fails that they've inserted, right? So we don't want to be in a position where if our tool fails, that we are now holding that responsibility when we have no power to do anything with it. So I just want to draw everybody's attention to that we are working very hard with Peter and with Julie Walter, who's been doing it with New Hampshire as well.
Thank you so much. Good to know. The American Psychological Association chapter in Rhode Island has been super helpful, part of our coalition for a long time, and I really appreciate all they've done to help inform me on the AI issue. Anything else? Okay. If there are no questions or conversation to be had, I want to thank you for participating in this, for those who presented, and I want to thank everyone who is watching online. This will be recorded and it will be placed on YouTube. It will also be placed on Mental Health Association's website. I'll give it to all the presenters here as well, so you can distribute it on your websites and e-newsletters. And thank you all for showing up today and having an interest in this policy work and for everything you're doing to make Rhode Island a more compassionate place to live, not just for folks who are part of the behavioral health community, but just in general. If each of us does a little bit, we can accomplish a lot. I firmly believe that. So thank you all very much and have a great day. Thank you.